we have a pleasure of hearing insights from the European Health Data Space Regulation from Rob Schubert from HippocrAItes. Welcome.
Good day, everybody. I'm Rob Schubert, and it's a pleasure to speak to you digitally here. As Elina mentioned, I'm an advisor at HippocrAItes, the Dutch Competence Center for eHealth, and I advise on implementing the European Health Data Space. I have an experience and background as an entrepreneur, having worked on several health data and AI companies, and now changing this into the regulation so that this perspective is viewed back into the European health data space.
And also joining us is Pekka Honkanen from HippocrAItes.
Okay, hi Rob, nice to see you again, I could say. We are interested in hearing about the original idea behind European Health Data Space Regulation. What was the goal behind it?
Well, indeed, likewise happy to see you again, Pekka. The original goal and the intent of the European Health Data Space goes very long time back. I remember writing my thesis about it in 21, and the first conversations or notes what I found were from 2012 already, with the intent of the Commission to harmonize the European health market a bit more as an internal market, so that there won't be as much separation and differences and silos. And therefore, the European Health Data Space has been created and formalized over these years a bit more structuredly, and afterwards these thoughts became more into concrete plans, and from concrete plans they can be more into concrete regulation, and from now, last month, this regulation has actually been published. So the European Health Data Space consists of three main pillars. The first pillar is to enable patients to have access to care, the best possible care in every facility in Europe where they are, and moreover giving them more control over the healthcare information and specifically their data. Secondly, that this data is more structured and therefore giving more insights to policymakers, innovation and research. And thirdly, to make the European health market more harmonized so that all the electronic health records, but also all the systems on the market are standardized and therefore are interoperable, and also therefore not having all these separate internal markets.
In this view, how do you see the vision, which is the HippocrAItes vision, that the European citizen can go to any healthcare facility with his data? So rather than the place where I'm going to receive a care, going to fetch my data from umpteen different EHRs, I would be coming with my data and share it there and then.
This makes the patient the center of care, and having the power, but also the choice, the free choice to go wherever treatment is most suitable to this situation. This can be indeed not at your nearest facility, but you rather go to where you believe or see that best treatment is happening in your case. And this functions obviously the best when you have already a lot of insights yourself on this data, on this information about yourself, so that you can make these informed decisions where to go. But also from the treatment side, that the facility where you would go to has this necessary information about you to give you the best treatment, because it might not be the nearest facility where all your history already is. Now you bring this history to this facility so that the best treatment can be given here.
So could we say that the EHDS was specifically, well, not specifically, but one of the intended outcomes was just what HippocrAItes is trying to bring to the market?
I'm loving your framing here. I'm not sure out of my role if I can say directly yes on this. However, I do strongly see this vision coming back in how the vision of the EHDS is intently written. That the patient has the empowerment, has the insights, has the knowledge about their own information, their own data, to go wherever treatment is most successful and also most preferable.
So, Rob, how do you see the concrete and practical consequences that the EHDS is having on the healthcare market in Europe?
The EHDS is going to be the biggest change what is ever going to be seen in the European or worldwide healthcare market. I would even state it here. And this big change is mostly in harmonizing. So where everything here is separated and siloed and structured differently, now it's going to be smoothened out so that it's becoming one single market. Kind of the intent of the European Union as well. However, this big change also means that a lot of actors who are having a good position now need to change into a system where they are more interoperable, where they are more intertwined with new innovations, with new developments, and therefore might also be losing some of their market position. Nevertheless, it also opens up the market position of all the separate member states into one. So it also opens up a lot of room for market expansion in that sense. Now, so coming back, it brings a lot of change, and this change often means friction. To smoothen out this friction, there's coming a whole set of regulations, but a lot of the regulation is already written in the mandate, the European Health Data Space, which is published last month. However, there will also be an additional set of regulations coming up, particularly also the implementing and delegating acts, which I'm working on. But these acts and will support either governments, either health data holders, either health data users, but also EHR, so the electronic health record systems, to facilitate these changes and go into the desired outcome of this European health data space. And there's very concrete steps of actions to take. So it's really a step-by-step guidance, but also it will be very concrete rules on which standards are going to be used across the whole European market.
How long you see that things like adapting standards in such a complicated area as healthcare, how long time you foresee that it has some practical implication?
This is a very significant change, and it is also connected to a rather ambitious timeline. And the regulation came into force last month, and now all the intended timelines are starting to run. So that means that all these phases of change have different timelines, starting with the first coming up is in 2 years after this publication, what happened last month, that the implementing and delegating acts need to be published by the European Commission. And these are these guidelines, what I spoke about, where all the healthcare electronic healthcare records need to be standardized on, but also all the additional infrastructure what needs to be built is going to be written down, how this needs to be organized in member states. So after this initial 2-year deadline, the actual real work starts to happen, because then all the EHRs and also all the member states know exactly what needs to be developed when and where. So from now, 25, implementing and delegating acts come in 2027, and then priorities need to be going into force. So that's already in 2029. And then the second priorities, what all these priorities are described clearly in the implementing acts, they will go into force 2 years later again. So that means that we're talking about 2 years after 2 years after 2 years. So make this into a bit more understandable language. 2025, that becomes 2027, that becomes 2029, and that becomes 2031. In 2031, we expect the European health data space to be in full force. Now it seems that there's a lot of years ahead, but it's also a very ambitious timeline to bring all these change to all these complex systems who are also now at the moment running on all different standards.
How do you see, as you are in the very, very heart of the action here, differences between different countries? I mean, there are small countries such as Finland and perhaps Estonia, which are kind of, you could think, easy to move. And then you have bigger behemoths like, say, Germany, who is not so easy to move as a nation. So how do you see?
I think that's the beauty of Europe, that we are living with all these differences. However, that makes it also indeed challenging on implementing standardized regulation, because indeed everybody comes from different backgrounds, and also everyone has a bit different resources to actually make this change. You see indeed different regions within Europe having already a bit more experience in digital care, but also you see some regions where it's still a bit lacking behind, where things are more on paper still. So that means these differences are needed to be overcome, and also that this regulation, what is intended to be completely harmonized, needs to take into account that there is this balance, and that perhaps we cannot move as fast as everybody wants, because everybody needs to be taken along. This is a constant balance what we take into account, so that we make sure that the regulation can be implemented by everyone, so that no region will be left behind.
Is it correct to think that Finland is rather on the forefront than being on the slow side of the markets?
I think in Finland, and I wish I was there live today, you can be proud of the position and the innovation you have done already. Actually, a lot of the regulation, and then looking particularly on the secondary data use, is inspired on the Finnish situation. There is already a lot of digital care. There's also already a lot of standardized healthcare, and insights are being are gotten from patient information data. And you're definitely upfront within Europe, and also inspiring the rest to take these steps as well.
Yeah, we could say that the Finnish healthcare sector has been pretty tech savvy for a long time, and working in collaboration, seeing the need to share the patient data and all the similar other things. And this has put us in a position to take advantage in the forefront of the implementation of the vision that EHDS is painting us. And that gives, of course, companies like HippocrAItes the opportunity to be on the forefront in bringing to the market new ways to utilize the technology for the healthcare and well-being of people.
I think this is a correct statement to make, Pekka. I have the pleasure that I know a lot about the Finnish system, but also I have the pleasure that I work a lot together with FinData, and so the Finnish organization for access to secondary use of data. And I can say that they are an inspiration for other European markets. So often all innovation, what is happening there are seen as steps ahead, and also the future situation of other regions. And this forefront role has also led to an international recognized position of interest of not just European markets, but also other markets of getting access to Finnish data to build innovation, but also additionally to see what innovation is built on this already existing data sets, what are utilized for secondary data use. So you actually see that a region what is now upfront is picking the fruits, let's say, of this early labor. And well, I cannot look into the future that much. I suspect that if you have a front-running role now, you will also have a front-running role later on, because I don't see the Finnish sector sitting still.
Thank you so much for your insights on the European Health Data Space Regulation. It's been really interesting.
Thank you. Looking forward to continue the dialogue with you.